the most progressive field, I think, of all. We're one of the youngest fields, but we were definitely one of the most progressive fields. It even says it in our name. We've debated about how to even pronounce what are we, physiatrists, are we physiatrists, but it's the phys part that matters. And what that means, the Latin root of that is nature or body. It's also the root for physician, and that's because we picked a field where we're looking at the whole thing, the whole picture. Most other fields are picking one part, whether it's the skeletal system or the nervous system or the eyes or maybe a population, maybe with children. And we've said, come all to us.
I think that we have a very different approach to diagnosis and management of patients. And I think that really is one of the things that's unique to our specialty. We do not have a single organ system that we treat, and I think in many ways that is our advantage, that we don't see people as a liver or as a heart or as a rash. We see people really as whole people.
Think about someone that has post-traumatic headaches after an injury. Those things may cause them to miss multiple days of work every month. It may limit their ability to get a promotion, which may limit their ability to do the things that they need to do in their life for their family. So the headache is just one component of it. Certain people will focus on the headache alone, but we get to focus on that whole patient, that whole scenario, to increase their level of function so that they're either not missing work because we find a medication that works well for them, or we find breathing techniques or acupuncture that can get them into a place where they don't have to miss so much work.
I think what unifies physiatrists, or what should unify physiatrists, is our emphasis on examination. I think that we understand the importance of that like no other specialty. I think that we know how to use it and interpret it like no other specialty. I think we know how to explain that like no other specialty. Part of the collaboration aspect of physiatry isn't just that you're collaborating, it's that you're collaborating with the patient. To me, that's where the answers are, is when you're really working with the patient and not just coming to them with the answers. And I think that provides the most benefit. I think that's where physiatry probably stands out among all the healthcare fields.
It's that level of creativity that really makes it special. That's different than if you were a surgeon where you had an operation for something, and if that operation didn't work for that patient, well, you don't have a plan B. We always have a plan B. It's a field full of plan Bs. It's really wonderful.
If I could tell physiatrists in training, one thing that I would want them to do is to focus on the examination, as opposed to just going through the motions of an exam, just to check off the boxes. I think that, as simple as that is, I think that sets us so far apart from the other specialties and makes probably the biggest difference in what we do for our patients compared to other specialties.
One of the most inspiring things that I've ever come across in my career was one of my former trainees who called me after Hurricane Katrina. She was one of the very few musculoskeletal spine doctors still operating in New Orleans after the hurricane. But she called me up and said, "Kathy, I have people coming in here. They've had brain injuries. I need to do something. Help me figure out what to do." There are very, very few doctors who, if somebody came in complaining of back pain, would be able to sit with them and figure out that they had actually sustained a head injury, and that was affecting their ability to manage as well. That simply wouldn't happen if you came into anybody else complaining of a back problem. That truly is one of the hallmarks that we have, is that ability to really look at the person in their own context, in their own environment, in their own kind of unique personality, and using that to help us devise treatment.
We are the next phase of medicine. This is how we need to think of the whole picture. We need to think of function, outcome, and goals. Physiatry is more than just the physician, just the patient. Physiatry is more than any individual body part or any individual disability. Physiatry is more than the hospitals or the adaptive equipment. It encompasses everything. Physiatry is the goal, the outcome, looking toward the future. Physiatry is hope.